Hey, mariachi
All right,
loco
we're live.
quiere bailar.
We're
Hey,
live.
el mariachi loco quiere bailar. Are we
Good
in
morning.
yet?
Yeah, we're live.
Believe it or not, and
I'm
it's
over here
You're live and
jamming.
you're dancing.
Good morning, everyone. Good morning. We are back live on Facebook. I am so glad to be back here again with Coffee and Pan Dulce. If you had a chance, go ahead and share our video and please enter your questions and tune in, share with all your friends. Good morning, everyone. We have full house today, I see. How's everybody doing?
Great.
Good morning. Well, listen, welcome to Coffee and Pondusa. Thank you so much. I am actually, I found a secret stash here. And so I am on day, actually my family is on week 5 of our stay-at-home self-quarantine. We have a wonderful show today, and I want to welcome everyone to Coffee and Pondusa. Thank you, Mama Ruth, for doing the introduction. Also, thank you, our co-host Jenny, for joining us today. Jeff Scott, once again, is on a hiatus until I believe May 15th, sometime around that time period. Today is tax day.
Used to be.
Thank you. You got that one. So today's April 15th. It used to be tax day. What is that? Well, it's now June 15th. It's been moved back. So if you live in the
we have a new guest. He just walked in.
Yes. Welcome, Councilperson. We haven't started introducing each other. So welcome all of you who are watching us on Facebook Live, also those who watch us later on YouTube and also on Facebook as well. I want to thank all of you for joining us, and thank you for the 4,000 plus people who watch us on camera too, which is kind of freaky, but they watch us. They want to see what I'm wearing underneath here. So let's go around the square. We've gotten a little bit used to this, and depending on how you're looking at this from your phone or your camera, let's introduce yourself and introduce the imaginary button, or if you have a button, and we'll go. I'm going to tell from my screen, we got Jenny, Judge Rex, Dr. B, Mama Ruth, Tara, and then Councilperson Newton. So we'll start with Jenny.
Hello, Jenny-Jaymes Gunn. I represent the Charlotte National Organization of Women and Charlotte Pride. LGBT activist and feminist right here in Charlotte, North Carolina.
All right, good morning, everybody. I am Judge Rex Marvel. I am a family and domestic court judge here in Mecklenburg County. Happy to be here. I just want to talk to you about how the courts are still working, still operating to serve everyone here in Mecklenburg County. Thank you.
I think I'm next. I'm George Bohmfalk. I'm representing healthcare justice and Medicare for all. I'm a retired physician here in Charlotte.
Welcome back, Dr. B.
Thank you. Good to be here.
Who's next?
You are.
Good morning, everyone. I am glad to be here every single Wednesday, hoping to join y'all. My name is Ruth Perez. I'm a community advocate, and my secret button today still and will ever be Medicare for all until I see it being done.
Hi, my name is Tera Long. I am a healthcare advocate. I am wearing my healthcare justice NC and a huge supporter of Dr. George Bohmfalk. And I'm also wearing my vintage Vote Rex Marvel for Judge button, which I wore and in how many years ago?
Wow. Excellent. And then
Good morning, everyone. My name is Matt Newton. I am the city councilman for District 5. It's great to be here this morning. I look forward to talking about the stimulus package that was passed by the city council on Monday night and our efforts moving forward to address the coronavirus COVID-19 crisis in our community.
We have another special guest, but she's not able to, I guess her microphone is turned off. So Barbara, if you go on your lower side, your left-hand side, there's a little microphone icon. Click on that so you can be unmuted. And then right next to it, there's the video. You can click on that to be seen so your video can go. If not, log out and log back in, and then make sure that you hit the video, joining in with the video and with audio. I hope that helps, Barbara, but we miss you. We love you.
Mama Ruth is our residential tech support. So thank you, Mama Ruth, because when we first started doing this, I think we all didn't know how to log in properly. And so thank you so much. But I guarantee you, we're all going to be Zoom smart in 10 more days, 20 more days. So listen, we have a very packed show. So before we start, let's go ahead, because we always forget. I always forget to do this when we're on the virtual show. We do this in the beginning. I'm Christian Cano, by the way, and I also have a button Medicare for all as well. I don't have my jacket on. I decided to show you what I usually wear all day long while we're at stay-at-home order until I walk out to the treadmill. I turn the TV on. I go, I'll do it next week. So this is my attire. But once again, as you can tell, I found I'm gonna hold this store as a secret until the very end on where I'm at right now. So we're going to start off. We have a lot to talk about here on the show today. Once again, we want to thank Manolo's Bakery, who's our conducive sponsor. Manolo's Bakery is located on Central Avenue. They are still open like any other small business. They're doing deliveries and takeout. This is Tera Long's daughter, Scancha, if she ever, not this actual one, but it looks like this one. And so we also want to, everyone, if you have your cup, salute to Coffee and Pandusi.
Oh, I have my cup.
Excellent. It is really weird making coffee for just one person. So,
Look, I have a cute one this morning. In case of an emergency, drink coffee.
and eat bacon. So let's start, because I want to make sure that our guests get as much time as they can. And I forgot to introduce Baby Trump, who's been watching our show virtually. He is watching our show. He's got a Medicare for All button. He's also got a Moms Demand Action button for gun sense legislation. And he's still passing out Cynthia Wallace signs, who's running for Congress. So thank you, Baby Trump. We appreciate your support and following us. And he's got his hairdo and everything today. Oh, I forgot. I got these in last week. It took him a while. These are my Trump toilet scrubbers. I don't know if you can see them. Got Trump's face on them. So I'm so excited to make America clean again. So, all right, we're gonna first start off with Dr. B, and everyone jump in if you have questions. Maybe he can update us on what's going on with coronavirus, COVID-19. I have a question for him specifically about someone who wants to come and cut my hair. Then we'll jump to Councilperson Matt Newton, who I hope can update us on what's going on with the City Council and the packages that they passed last night. And then Judge Rex, we'd love to hear from what's going on in the courts and how it has impacted you and so forth. So Dr. B, we'll start with you. Can you tell us any information you want to give us?
Well, sure. Yeah. First, my usual disclaimer, I am a real doctor, but I'm not an infectious disease or a viral specialist. I'm a retired neurosurgeon. But from my medical perspective, I'll be happy to answer any general questions. As an overview, you know, we're kind of hearing things from New York City that they might be plateauing and whatnot. And for better or worse, that has sparked this you know, kind of big talking about, oh, when can we reopen and everything. And so far, I totally agree with Governor Cuomo in New York and also Governor Newsom in California that you better be careful because, oh man, I just read, probably all of y'all saw the thing in the Observer Sunday about the Spanish flu epidemic here in Charlotte 100 years ago, and about how the city really wasn't reporting the deaths accurately, and the business community wanted to reopen, and so they did, and they had a huge second wave, a lot of unnecessary deaths. So I would just urge everybody, I know how hard it is. I mean, I took a walk around and saw how many of these businesses are closed yesterday. It just looks like after the nuclear bomb. I mean, it's striking to kind of walk around and see the lack of activity. And I know it's painful for everybody except the few businesses that are thriving right now. But we just have to tough this out a while longer. And I don't think it's going to be the fall or anything like that, but just don't get in too big a hurry and pressure your elected officials and others to reopen things. We have to reopen things intelligently based on data and very gradually to watch for other waves. I mean, I'm not immune. So if I start kind of going places and some waiter, you know, coughs on my food, I'm in that high risk group. And so for a lot of folks, everybody, we just need to be very intelligent and science-based and not emotional and worrying about the economy. So that's where I see it right now.
Well, and I got a question, Dr. B. I
muted
watched
myself.
this one bariatric surgeon from Texas give a lecture on COVID-19. He said, we really won't know when we've hit the peak until several weeks after it peaks. And I don't know if you could expound on that, but I think we got to be cautious because there's a lot of cities in Europe that got a second wave because they opened up too early.
Yeah. Yeah, I think the concern is you know, we're seeing the two figures, and one is the number of cases, and then we're seeing the number of deaths. And as they keep telling Fauci and Cuomo and all these keep insisting very correctly, the number of cases, first of all, that can start coming down while the deaths are still going up because that's new cases, and the deaths are old cases, folks that have been sick for 2-3 weeks or something. The big flaw here is that the number of known cases only reflects the amount of testing that's been done. And I think there's some statistic came out that so far, less than 1% of the US population has been tested. So heavenly days, I mean, God knows how many cases are really out there. And so I tend not to look at the number of cases very hard because it's such an artificial number right now. And I look at the number of deaths. And I think when we see deaths going down, that's when we can start to maybe get serious. But it can't be one day. Like in New York, I think they've had like 1 or 2 days of decrease in deaths. And then they said, well, you know, there are hundreds or more of people who are dying at home and who up to now haven't been attributed to coronavirus. And now they're attributing some of those, I think, correctly. And so you got to look for the longer term trend. And I know it's hard to be patient, but I think we just have to be as patient as we can with this.
Mama Ruth, did you have a question?
Well, my biggest concern is, like, I think he already answered it. I've heard him. Sometimes we are walking around, maybe going to the store or whatever, and we don't even know who's carrying the virus because it hasn't been tested. Last week, where because they were doing it 3 days later, teenager being diagnosed. So I got a shock. I mean, I was in shock. I was very terrified because, you know, I have a 73-year-old woman living with me and my mother, and I'm trying to prevent myself from going anywhere to save her, to be for her. So yes, as we walk around, we don't know, and we think that, oh, well, it's a close friend. I know him. He's probably not traveled or anything, but we have no clue that could be hitting our homes real close by.
I know, you just kind of can't be too careful. I mean, it's a very insidious virus. Like you just said, you never know who's got it. And evidently it was a little bit of a surprise after this had been going on several weeks to realize that people can be not having symptoms, but they're already spreading the virus. And so that's what makes us so dangerous and so stealthy. So you just kind of can't be too careful.
Dr. B, I have a question.
I have.
Go ahead, Tera. Tera, go ahead.
So
All right. You're breaking up.
Can you hear me?
You can now, yes.
Here we go. Okay, I want to know about the immunity. I want to know, can we get immune to this, or is this something that we can recatch? Because North Korea is saying that people are recatching this, and the Netherlands has a plan where they want people to build immunity. So what is the correct answer to that?
The correct answer is nobody yet knows yet. There's some, all the seasonal flus for the last several years, you get your flu shot and then you still get the flu. And everybody kind of says, well, this year it was 40% effective and the next year it was 60% effective. So there's probably hardly any vaccine or immunity that's 100% effective. And since this is a new virus, we don't know yet. Nobody knows. So God willing, those who get sick will have some immunity, but the next question is, how long does that last? Do your antibodies stick around for 3 months or a year or more? Viruses behave very differently, and like measles and some of these others, polio, once you get them, it seems to be almost lifelong. But with these flu things, probably not, because they mutate. They just change so much more rapidly. So we don't know. And, all of these things you hear about, well, people who've had it, they're taking their blood and taking the antibodies and giving them to the sick people. That may or may not work, or it may or may not work for just a while. So those answers are still out, unfortunately. And as far as building up your immunity with things like vitamin C and vitamin D, there's just no evidence for that. I suppose it's healthy to take, I don't know if it really is or not. No studies have conclusively shown that taking supplemental vitamins helps with almost anything. So keep that in mind. And some of these things you'll see on the internet talking about taking these massive doses of vitamin C or something potentially can be harmful. So, I think just keep yourself healthy, drink some orange juices. That's what I do every day, but no more than I always do. There's too much unknown. I'm sorry.
That was an excellent question, Tara, because that was the question I had for you, Dr. B, was about the antibiotic. How will we know when this test comes out, if it does come out, or that they have a test that's going to come out that's going to test test our blood to see if we had this and we didn't know? And so that's a very important question, because the argument I hear from people who want to reopen everything, like the group that was in Raleigh yesterday, I think their argument is, let's just reopen the government, build up your immunity, and so we can, that's kind of their argument. Is that, as you mentioned?
Yeah, you hear a lot, there's kind of a buzzword going around about herd, H-E-R-D, like a herd of cattle, herd immunity. And the notion being that if enough people in the herd, the whole population, have resistance to a disease like we do with polio and smallpox, that minimizes the risk of other people getting it. We've heard that with the anti-vaxxers, the people that don't want vaccines, and therefore that means fewer people in the herd have immunity to common diseases like measles and stuff. And that can be very dangerous to reduce it. But we can't just kind of willy-nilly say, okay, let's everybody go out and get a little case of this COVID virus, so we'll build up our herd immunity. The problem being is I'll probably die along with a whole lot of other younger people, and certainly those of us in the higher, older age risk categories. So I think that's short-sighted. It sounds real appealing. I think it's overly simplistic to say, let's just kind of open up everything and, oh, sure, a few people will get it. Oh yeah, a few people will die. I think that's pretty harsh and unrealistic. I think there's a good chance that enough people would probably suffer and die from that the damage to the economy would probably be worse than doing something gradual and intelligent.
Dr. B, we have a comment on Facebook Live. It says, I heard and seen a video that got taken down that someone said that they found out some people can and could be immune to the virus without knowing because of the blood type. Have you heard anything about that?
No, I haven't heard that, but there's a lot of stuff on the internet that I haven't heard that's a little bit edgy. No, I don't think you're AB positive or O negative. I don't think that has one thing in the world to do with antibodies in your system. No, so I would discount that.
Great.
One of the concerns that I have, and I wish we had Commissioner Jarrell on this. He was on the show two shows ago with Councilman Newton. I was calling Newton Governor Newton and him Mayor Jarrell. One of the concerns I have is there's a lot of reporting about how this is impacting African Americans, our Black neighbors at a higher
Hispanic,
percentage.
yeah.
Yes, and Hispanic people of color. My concern is, and this is when I saw that news report about the Trump, they were really Trump supporters that were doing the outside of Raleigh yesterday, honking their horns, wanting to reopen the government. The reality is, just like with those of us who remember HIV and AIDS, that crisis, when a certain population gets attached to something, if it's impacting them but not us, there are people that start to go, oh, it's them, let's reopen the government. And so my fear is all the reports that are coming out saying it's in Mecklenburg County, it's impacting African Americans at a higher percentage, and the death rate is higher. It may give some other people a false comfort thinking, oh, it's not going to impact me, it's going to impact them. Does anyone have any comments on that?
I do.
Yeah, go ahead.
And the reason I do is that you look at an area like in Queens in New York, for example, it's very, very populated and dense. And it traditionally has a strong African American and very diverse community. So when you look at a community, that it's a lie in the stats. You know, if you say, well, yeah, that community was adversely affected and the African American community was adversely affected. Well, yeah, because they're a very dominant part of Queens. It's a very diverse community. And most urban areas that get affected that are very populated and dense tend to have a more diverse community versus the suburbs and the rural areas that tend to be more white. So if you're spread out more, like here in Union County, there's less cases here in Union County than there is in Mecklenburg County, because Mecklenburg County has 6 times the population. And so that would be my answer to it, is that it's not really, it's just the makeup of our cities traditionally.
Well, let me throw in another thing. And again, in that report in the Sunday Observer, it referenced another kind of story that was going around with the Spanish flu 100 years ago. And that was that African Americans were somehow immune to it. And that was absolutely not true at all. But there were all sorts of pernicious results that followed, as you say, Christian, attaching any sort of ethnicity group to it. And, you know, obviously, the complicated issues are complicated. So it's really dangerous to come up with simplistic assumptions and conclusions. And I think there's a whole host of reasons why this is affecting African American and minority populations more. And Jenny correctly noticed the population density. Folks are more crowded together in lower socioeconomic groups that tend to be minority. And they've I think, borne the brunt of some ethnic discrimination over the years, so that their health as a group is not as good because they have a reduced access to healthcare. There are tremendous healthcare disparities that follow racial and ethnic lines, and I think that's what is probably playing out now with COVID. Folks in those communities don't have equal access to getting tested or even getting evaluated, and they just cannot isolate themselves. How do you isolate yourself when you live in a household with 15 other people? So there's a whole lots of practical, understandable reasons that go far and above beyond a simplistic thing about, oh, those people, you know, are more susceptible.
As of yesterday, North Carolina has a report, and these are all positive cases that they've been tested, 5,000 positive cases. And out of those 5,000, we have 300 Latinos being positive. So our numbers, to come to the reality, we are. And those are Latinos that consider themselves, because some of them don't even put they're Latinos. Once they're asked a question. So our numbers are getting higher. And I heard that, yes, Black people or color people are more into getting positive or getting transferred or getting sick through the COVID, but I'm seeing the numbers that are being leveled into, like Jenny said, into all of the people that are around North Carolina. So it's not just a group of people. So if we decide to open, or if governor decides to do something aligned to our crazy president, that could harm the whole entire nation.
Yeah, I would not disagree with that. And I want to jump to Judge Rex, because we have him on here, and welcome to the show, Judge Rex. I know you have not joined us in person, so it's great to have you virtually here. How is this impacting the courts?
Oh, yes, certainly. And you might be aware that the courts are reduced. We're not hearing the same volume of cases that we were. And there've been a lot of changes as far as how safety precautions are in the courthouse. But I've also seen some reports that might indicate or make people think that the courthouse is closed altogether. And that's absolutely not the case. With COVID-19, we're hearing what's called emergencies or constitutionally essential cases. So as a family and domestic court judge like myself, that means I'm hearing cases of domestic violence and emergency custody for children. So there's a big concern right now that, for a lot of children in our community, their safe place was school. They were able to go to school and that was their structure and that's where they were able to get fed. But now when they're stuck at home, there's a potential there could be an abuser there. And then with all the stresses that are already onlining, there's a big concern that there's an increase in violence for both children and for victims of domestic violence. So I just really want to stress that I'm on my computer all the time and I'm checking for requests for emergency custody. I'm going in on Friday to hear domestic violence protective orders. So your judges are still working. And we're definitely addressing the big concerns that we have while everyone's under the stay-at-home order. And if you want, I can talk a little bit about the safety precautions in the courthouse as well.
Please do.
Yeah. Well, it is unique, and it's not what I was used to seeing. I've been here for a while as a public defender. I'm in the courthouse every single day as a judge as well. And you're used to seeing a lot of people. That's not the case anymore. But one thing that they do, and they've implemented, is temperature checks for staff. So everyone that's coming into the courthouse is getting their temperature checked to make sure that as a deputy or a clerk that you're not infecting someone else. The other thing that they're doing is we wear gloves and masks. So as a judge, I'm wearing a mask around. My clerks are all wearing masks, and the deputies enforce social distancing. So there's never more than 10 people inside an individual courtroom. And they also, so when I'm hearing an emergency custody case, I'll call a party in one at a time, and then the deputies disinfect the desks and the doors as each group goes in and out, just to limit the exposure. And it's, obviously the courthouse isn't built for that, right? And we had to make these changes in a really short period of time. And I really want to compliment Justice Beasley from our Supreme Court Justice, and then Judge Trosh and Judge Bell, our chief district and superior court judges, who have really been pushing this and listening to the judges like myself, just based off our experiences and what we think would work. And we're really doing absolutely everything we can to keep things going, because like I said, those emergencies are happening and we have to hear them.
Wow, I guess I never really thought about all that has to be involved in not only keeping the staff and the employees and everyone safe as well. So let's say hypothetically, this is not your area, that I had a traffic ticket, a speeding ticket, passing a red light. Are they still going to hear my case?
That is a non-essential case. So that was continued. And I think you can keep checking in with the clerk's office. They'll update you. At the earliest,
Should be out anyway.
Things are great. Everything is going to open up back again on June 1st. That's the hope. Obviously, everyone wants this stay-at-home order to be effective and our distancing to be effective and for us to flatten the curve and start reducing. But, it's possible that it could go longer than that. And they're just going to make a judgment call based off what the health officials recommend. But you're good.
Well, so let's say hypothetically, no, I'm joking. I'm sure that's what everyone was thinking was, I wonder if I'm still going to have to pay my ticket.
Well, yeah, there's some clarification on there. It's posted on the court's website. So just, yeah, there you go.
Well, full disclosure, I have not received a ticket in 8 years. So I drive like a granny. That's why when Jenny and I were going to do a show,
Uh-oh. He went away.
He froze.
Yeah, we were going to, We were going to do a comedy show on Saturday mornings called Two Queers in a Truck. And we were going to drive around and interview people and probably eat some food and stop off some places and just kind of do kind of like a show about nothing, like the Seinfeld show, except we'd be in his sport utility driving around and just seeing Charlotte. It was just off the cuff. I think we were at Sidelines or coming from Sidelines, the sports bar. And we came up with this idea and we were laughing our heads off talking about it. But, you know, one of the concerns, and I saw this from the Washington, D.C. mayor, and you could speak to this, Matt, is you know, there's so many essential services in the Washington, D.C. area that if that were to shut down because of a reopening of the district, or a contagion got really bad with all the governmental workers, we would have a tough time operating the Treasury and all these essential things that we deal. How has there been any talk with the city of Charlotte on how y'all would deal if you did get short-staffed in an epidemic, or what would that look like?
Yeah, and that's why we have Matt Newton with us. Matt, if you can answer some of those questions, thanks for that package. And we would like to hear a little bit more about, for those that didn't have all those 4 hours, over 6 hours to listen to the whole meeting.
I could have gone all night, by the way, because this is all, and I know my colleagues would agree, this is a very important time for us to step up and deliver for the community, make sure that everyone stays healthy, and make sure that we have a soft landing coming out of this, whenever that might be. Having said that, I think it's also important to note that, so to Christian's point a moment ago, simply because there are services or there are components of the courthouse that are closed down, it doesn't mean go out there and break the law, right? There will come a time when the courthouse opens back up again, and when it does, those tickets are still going to be there, right?
They're still open.
So
they're still open. They're just backed up.
I mean open up for the broader range of cases that they see, like traffic tickets. To your point, Jenny, so yeah, we have had those conversations. We know that, so we're looking at our paid and sick leave for our employees. We provide services like solid waste, transit, I think certainly police and fire that people, I think, more immediately, see, but we know that we need to ensure that our employees have the ability to take the time off if they need it, and we're going to make up for that, of course, with over or double time, and then also through other measures. So those are conversations we are having, and we're certainly having that in the budget context, because we know that we're going to have revenue loss, and then there's going to be expenditures increased on the other side to make up for some of these contingencies that I think we anticipate could happen. So we're talking about all of that. And I did want to touch on, so before maybe hitting on the package from Monday night, I wanted to say a few things here. First of all, I do have a hard stop at 10:55, so I'm sorry if I have to jump off, everyone. The other thing too is we do have, so speaking about disparate impact, the exemplary leadership of Mark Jarrell, so Commissioner Jarrell brought together a group of community leaders. We spoke with representatives from Novant. We discussed the disparate impact in East and West Charlotte. There were testing centers in Huntersville, testing center down in Matthews, but in areas, communities of color, the areas that are more marginalized, we didn't have the medical facilities, and more specifically testing facilities for COVID-19. So today there is a mobile unit set up at the corner of Albemarle and Executive Center Drive. It's going to be there until 5 o'clock. There's also one at 2845 Beatties Ford Road. So these are walk-up centers. Anyone can walk up to them. You can get screened and you can be tested. I've been asked by a number of folks, how much does the test cost? So speaking with the representatives from Novant, if you have insurance, the test is free. If you're uninsured, the test runs approximately $50, but they will knock off 40% of that if you're able to pay on site. So I just wanted to answer that question as well. Please, if you feel like symptoms of COVID-19 coronavirus, please go to one of these sites, get screened. You won't be tested if the screening doesn't suggest that the symptoms exist and you are a likely candidate for being infected.
Lost him.
Wanted to give a plug because I don't think that Judge Marvel mentioned this, but now he has his own show, Social Distancing Social, which is a lot of fun. He was probably getting around to it, but I'm going to beat him to it because I watched the show. It's great. I am a bit partial because I've been on the show. So myself and Representative Christy Clark, that's a really great episode. You're going to want to go back into the archives to watch. I like to think it's one of the better episodes. So follow Judge Marvel and Social Distancing Social. But yeah, speaking about the package on Monday night, what we did as a city council was we identified what we call gaps in the community. So areas, spaces from the standpoint of policy and governmental intervention where relief is not being delivered. And so we specifically identified housing gaps, and we identified gaps within our small business community. So the package on Monday night was meant to address those gaps. I can get into more specifics. Much of this was funded with federal dollars that came down through the coronavirus phase 3 stimulus package. We're hopeful that we can get some more federal funding from the phase 4 package, particularly to cover budgetary gaps. So our budgetary operational gaps. But in the meantime, we did approve $5.5 million for rental and mortgage assistance. We also, so of that $5.5 million, we included security and utility deposits, and 1.3 of that is going to go towards helping our homeless population who are very vulnerable during this time of crisis. We have a stay-at-home order, and we can't overlook the fact that there are people that don't have a home to go back to and stay at. And so we need to do our part to make sure that they have a roof over their heads as well. So that's what that 1.3 million is all about. And then $1 million to what we call micro businesses, which are businesses that are that employ between five or less employees. So that was included. We specifically targeted what we call our opportunity corridors. So the areas where we can pinpoint where the need exists the most. And so for us in East Charlotte, that would be Central Avenue, Albemarle Road. On the west side, it'd be the Beatties Ford, Freedom Drive corridors, West Boulevard corridors. So that's what we did. The question, of course, is, was it enough? And so we have task force that the mayor has set up where we'll be discussing more specifics pertaining towards to business, housing. I'm on a task force for the airport. So, we'll be discussing this as we move forward. With this package, we're going to be able to collect some data that we can then act upon as well to further identify pockets of need. And so this is just the start. We're going to continue this conversation, and it's my expectation, the expectation of other council members, that we will be looking at a phase 2 package ourselves. The bigger question, of course, is what's the scope of that going to be? Where will the funding come from? And I'm happy to discuss that as well.
Matt,
Yeah.
that in that package? How did we accommodate our seniors in that package?
In the package from Monday night. So that's a very good question. That was a question that I raised. There is no exception or priority, unfortunately, in that package for seniors. Now, once again, we'll be discussing more relief moving forward. I think the question's not going to be whether or not we deliver on more relief. The question is going to be how much are we going to deliver, and if that includes, if we're able to target populations that are vulnerable and more susceptible to the needs created by this crisis. I think you and I.
I'm asking you for the reason is that here in North Carolina, we've seen an outbreak, especially in nursing homes. We are seeing a lot going on. So what are we doing to help all these elders? I mean, we're talking about rent relief, mortgages, and, businesses and stuff, but what are we doing for our most vulnerable elders that are out there left alone?
Yeah. So as I was mentioning a moment ago, the package on Monday night did not specifically prioritize our seniors, and that's something that I think we need to do on a local level. And moving forward, it's something that I will ensure is part of the conversation. Now, as it specifically pertains to nursing homes, I think to your point, the question is well, what does rental and mortgage relief do for nursing homes? We can discuss other ways maybe of assisting in that space, but what we do know is that the state government is imploring guidelines, and frankly, I believe there was an executive order last week that really clamped down on the interactions allowed in nursing homes. We have so for me, I feel like we can and need to do more on a city level, but we're also working in conjunction with state, county, state, and federal partners, and so we don't want to duplicate efforts, and that has been more of the state space for the time being. But it doesn't mean that we can't work together on that, and it's my hope that we do that as we move forward, and certainly something that within the housing task force needs to be discussed.
Now, I know you have to leave by 10:55. Dr. B has a question for you, but we would like to extend the invitation for you to come back on Saturday morning if you're available to kind of extend more about this conversation, because we would love to hear more about what's going on with RNC. There's a lot of things that city has not mentioned and has not allowed us to question, and we would love to hear from you.
Sure. And I might not have, so let me be clear about this too. I might not have all the answers. We are working very hard to address the need that exists. We're looking to identify where. So two things here. We're looking to identify the need, and then the funds to address the need. And I'm one member of a council that constitutes 11 people. So I'm having these conversations with my colleagues. I'm having these conversations with our mayor, but we do act collectively too. So I will do my best to answer questions. At the same time, understand that the city, our ability to address everything, unfortunately, is limited in scope, and we do work collectively as a council. So I can't say, we're going to do this because Matt says we're going to do this. We're going to do this, assuming that the council's on board, and even with the package on Monday night that seemed to be an absolute no-brainer for me, we did have some council members vote against some items of relief. So it's not as open and shut as it might appear for us.
And I agree with that, Dr. B.
And getting some of this delivered.
Matt, let me ask you one thing.
Dr. B has a question.
I know you can't speak for the whole council, but you mentioned how this testing, for the uninsured, they're going to have to kind of pony up something, and for most of the uninsured, they don't have that out of pocket.
Mm-hmm.
Senator Sanders, Bernie, and Representative Jayapal in the House have formulated an emergency relief bill that we hope might be part of this next package that basically, in so many words, provides Medicare for all with no deductibles and everything, and including prescription drugs for everybody who's uninsured and who's just lost their insurance because they lost their jobs until there's a vaccine or until this pandemic is over. Now, I understand that if the city can't make that happen or not, but do you think the city would be amenable to endorsing a short-term relief measure like that for Medicare for all just until we kind of get out of this?
And so I want to be clear about it, that's not really typically our space. That is so a lot of the healthcare aspect, and not to say that that's not something that we can't discuss and talk about.
That's for the county.
But yeah, that's more of the county space. And then from the standpoint of, Medicaid, Medicare, which, I feel like we definitely need the expansion, the Medicaid expansion here in North Carolina. That's more the state, the federal space. I would agree with you wholeheartedly that everybody who needs a test should be able to be tested. And the fact is that we can identify disparate impacts based upon race. We can do that too based upon socioeconomics, and there is. And so the question was asked for a real reason here. The question about the cost of the test, because costs can be prohibitive, can't they? And so I am fully aware and appreciate that, and we need to be able to make sure that everybody, and it's not just the cost of the test, it's also the treatment, because treatment it can be exponentially more expensive, and so I'm on board with that. I just given the full scope of need, knowing what our lane is within the city, which is typically, city services, housing, and housing and economic development. It's a little tougher to broach that subject on the city side rather than the traditional conventional governmental entities that do that, such as the county, the state, and the federal government.
I understand,
but I'm not against. Let me be clear.
Yeah. The city of Durham several months ago did endorse Medicare for all as a widespread thing. So it's not. I know that it's not necessarily the city's main focus, but if every city in the country basically kind of said, we endorse this short-term Medicare for all solution for the duration of the pandemic, I think that would be immensely powerful statement. So just as kind of a token statement, I think.
Yeah, Matt.
Maybe if you can bring it to the table, Matt.
Yes, sir, and I would agree with that.
Yeah. Jump in, because I know you need to jump off, but exactly what Dr. B is talking about is these things that the cities are doing all across the country, cities, counties, parties, so to speak. They're passing resolutions in support of Medicare for all, because as we know in Charlotte, with the amount of people that have lost their job or who will be losing their insurance under Medicare for all system, that's one less thing a public official has to worry about, because their health insurance will travel with them. So we wouldn't have to, you wouldn't be spending 6 hours at a city council meeting debating who's going to pay for a test. You would be talking about other issues. And so this really saves local cities and counties and states. We wouldn't be talking about a budget holdup, because Medicare, we wouldn't have to worry about Medicaid expansion because people would have insurance. So I think this really does impact all the way down. But that was a great question, Dr. B. And I hope
thank you, Matt. I know that no one ever has the exact answer. We have to kind of meditate and kind of print out a plan, but we know you are a very influential inside the city, and even though sometimes they try to shut you up, you still speak out, and we appreciate that. We're not expecting to have all the answers.
We will still find things to argue and debate about. I guarantee you, Christian, these meetings are still going to be 4 to 6 hours. But you're exactly right. Where we can identify, and there's a lot of need. Once again, the question is can we fill it all? I think the general the conventional wisdom on this is no one governmental body can do it all. We all have limited powers, limited resources, but collectively we can. And this is where we need to do a better job of, the old term of the silos. We have to tear down the silos between governmental bodies. We've done a lot of that. So with the county passing its package last week for small business, that's we traditionally on the city side we focus on economic development, and then us with homelessness. Normally that's on the county side. So we're doing that. We're working across these aisles. But you're exactly right. Understanding the need for healthcare during this crisis, our ability, if we have the funds to address that need, not to the exclusion of other needs either. So doing it in a more comprehensive, collective fashion. I agree with you. We need to do that. I would encourage everyone. So everyone here, of course, and everyone watching at home, I would encourage you, don't be reticent, don't be shy about reaching out to council members, having your voice heard, pushing these issues, being upfront about the need, one, but then two, also saying, hey, look, we know that there is, there are funds there, where we know that this can be done, right? And really pushing that message and that narrative because that's needed. The advocacy piece is needed.
Thank you, Matt. We'll hope to see you on Saturday.
Okay. See you guys. Thank you.
Thank you.
Yeah. And I appreciate you mentioning the homeless population. That's obviously a huge concern. And I volunteer with my church at Urban Ministries every month, and we're doing a kind of a food drive thing for them now. The difficult thing is for a lot of people that don't have, a house and those services, they have to congregate to get access to things like food or to meet with get some certain medical needs, at some of the limited clinics that we have. And it's heartbreaking. The other thing, if you have the ability to help or support, is an organization that I care deeply about, is the Relatives, which is which supports homeless children and homeless youth. And they right now are, like everyone else, lacking, food, lacking medical masks, lacking tents and other things that some of these folks unfortunately need right now because, and there's also the fear of people staying in shelter. I just listened to a report on NPR yesterday about a shelter outbreak in San Francisco. So, this is all, it's a sad and morbid topic. We've got so many problems all over the place. I know what Councilman Newton was saying and what I'm saying. Like I can address what is my little sphere of the world, which is, domestic violence and child abuse, at least in the court system in Mecklenburg County. And then I can try to say, hey, help these other organizations I'm familiar with. But there's so much need out there. We all really need to try to do what we can with what our influences and what our abilities are. So.
Well, thank you, Judge Rex. I can tell you, Dr. B and Tara, we're gonna hold Matt's feet to the fire to at least get a meeting with you guys, because he's one of the most receptive council persons that we have. Him and many of the others and county commissioners, because I do think it's important, especially during this time, that we take an even more serious look at the Medicare for All, considering people. Well, as Councilperson Newton was speaking, I was struck by the karma. My computer overheated, and so so you saw me waving it around to try to cool it down. And so I can never make another joke with Councilperson Newton's phones and so forth. And as he was speaking, we almost sold out of toilet paper. So I'm sorry, y'all. I was gonna tell y'all about the toilet paper, but I do have a great prize for you. Last Saturday, we had a guest, Lauren Ansley, who is with Lauren Ansley Comedy, and they have a group called Barely Funny that has now gone virtual. Their first show is tomorrow, Thursday night, It's $10 to watch the show. We'll post that link on our Facebook page as well. And the first 3 people that send me personally an instant message, I'll buy you a ticket. And she's also given us 2 more tickets. Anyone on this panel, if you'll just let me know, I just need to get your email address and she'll send you a ticket. It's a virtual comedy show. It's tomorrow from 7 till 8:30, I believe. Is that right, Jenny?
7 to 8, I believe.
Yes.
And we have an absolutely, I got to see a preview of the 2 comedians that are going to be on tomorrow night's show, and they're absolutely hysterical, and they're completely different people. The personalities are just hilarious. I mean, they can almost just sit there and be funny, just their body language. But it is going to be it's a fabulous format that I've been working with Lauren to develop, and we are working hand in hand on a lot of projects to bring comedy and laughter to people in different markets, including Charlotte area. And it is a locally owned business. Her company's name is Beerly, like the word beer, Beerly Funny. And so she was doing live comedy shows for several years here in the area, and now she's had to go virtual. So it's going to be awesome and super funny. And I hope people tune in. And the $10 is more than worth it to sustain these comics that had a thriving careers, and then the pipeline just got shut off. And so their livelihood, these are professional comics. This is what they do for a living. And they bring a lot of joy into our lives. And let's support them. Let's support entertainers and people like that. We don't want them to go away.
I think she's brilliant. She's a brilliant small business person. She has taken this situation and tried to not only continue to entertain us, because we need laughter during times like this. I will be with my glass of wine and my cheese balls. I don't know if you can see them with this green screen.
If you put them in front of you, then we can see them.
Yeah, that's right. Well, I needed to show you my friend Krista McCaffrey here, who's working out in the background. This would not be social distancing, by the way. I want to congratulate him. He just signed a 4-year, was it 5-year extension for $60 million. So yes.
He's staying with the Panthers?
Yes, so he's going to be.
Oh, that's awesome.
Yes.
Everyone else is gone, but we have Christian McCaffrey.
That's right. I am very, very excited that's happening. But let me show you what this is the reason I have this screen on. I'm sitting on my Archie Bunker chair today, and this is what you would have seen during the show. So that's the reason I have the screen on, Mama Ruth. Listen, we do value everyone's time, and we've gone just a little bit over. We started a little bit late as well. Let's see if we can. Tara, do you have anything else you want to add before we end the show?
I absolutely do. I've been watching Cano since the social isolation started, and he has really just led the way. He has turned on his camera. He has invited people to the show, and you are turning out to be a true champion during this social isolation period. So this is a tribute to you, Cano.
I agree with that.
Well, thank you. You know, we started the show, this is our 70th show. So we started it November 2018. So we've been going on, and the whole purpose of it was just to educate people, specifically our Latinx community, English-speaking Latinx community between 18 to 45 on issues that may impact your family and their allies as well. So it's not just me, Mama Ruth, Jenny, Jeff Scott, Barbara, who we can't see, but she is here.
We'll probably hear her next week.
Yeah, we'll hear her next week. You know, Tony Foreman, our brother Tony Foreman, who also helped us with this as well. And so once again, we do want to thank everyone for joining us. Let's go ahead and get everyone's last words in 30 seconds. And I'm just so grateful that we have Baby Trump with us, because it's important that he hears from the people on what's important in our lives and so forth. Yeah, that joke is being milked. Obviously, I won't be on tomorrow's show.
Especially today that a lot of people are getting their stimulus check.
Yes. So that's a whole other. His name is going to be on it.
Oh God, yes. I feel like a slave now instead of a resident.
It's just crazy. All right, so let's end the show by going around, and Mama Ruth,
I want to make sure before we close, I want to make sure that if we can do a show next week about how some of our grocery stores are hijacking our prices. I've had a lot of residents, especially our Latino community, even Compare Food CEO got mad at me and blocked me, and he tried to play it off saying that eggs had gone high and he had to spend. But I mean, you wouldn't spend $10 on a carton of eggs, that's for sure, or $15. So we need to do something about it.
Yeah, exactly. Today was this show was the last one we had a title for the show. So we've got now that the stay-at-home order looks like it's going to be extended at least to the end of this month, and maybe even till May, we'll come up with some more titles for the rest of our shows. But let's go around, and Mama Ruth, if you haven't read the message, can you make me host, because we have to end the Facebook
How
Live.
in the world am I gonna make you host?
I don't know.
I want to keep myself now. Ooh,
Well,
you're out. I'm playing. Hold on.
All right, so let's go around. Tell us where you're going to be, or tell us, besides home, in 30 seconds, and thank everyone for joining us who's joined us. I hope this has been informative and a little bit of entertaining.
You're the host back.
Oh, excellent. All right, thank you. All the behind the scenes stuff that people are watching here. So we'll go Judge Rex, Dr. B, Mama Ruth, Tara, Jenny, Barbara, and Councilperson Newton, who's already left. So Judge Rex, tell us final thoughts.
Just thank you again for having me. I really appreciate it. And I just want to stress to Mecklenburg County and our community that your courts are still operating, even though we've limited it to emergencies. So if you have an emergency, if you yourself are a victim or you know of a victim, please remember that we're still open and operating to serve that essential function of the government. Besides that, just support those that need it. Right now, I mentioned there are a lot of services and service providers that aren't able to work in their fullest capacity. Do what you can to help your homeless neighbors and your at-risk neighbors. So thank you again. Thank
you. Who's next?
I guess me. Yeah,
okay.
And the main word is try to stay calm. Believe the scientists. Don't get carried away with false promises. As they all say, this will pass.
Mama Ruth.
I just want to say thank you, Judge Marvel, for accepting our invite. We really appreciate all that information, especially for the numbers that have gone high right now as domestic violence has risen. And I hope that it's not the first time that we can count with your visits more often. You can come and share with us more information throughout this process. Thank you, Dr. B, for being here with us. Thank you for answering our questions. And you're part of our co-host team, so you better not go anywhere else. Thank you, Tara and Jenny. Love y'all. See y'all next Wednesday. Don't forget, we have a show on the weekend, Saturdays morning. Hopefully we'll get more questions answered and more public to get more active. And I'll be here. I don't have nowhere to go.
Girl, I seen you sneak out to the store. Miss Tara.
Okay, so actually I'm going to be pretty busy. I got a call from one of my friends, and she's doing a Zoom with Biden's staff, and she wants me to talk about Medicare for all. Yay! So that'll happen probably sometime in 2 weeks. And Tiffany Sunshine Brown as well. I will be a guest speaker on her show. So I'm looking forward to reconnecting with all of my friends, and I'm super grateful, and I miss everybody.
Miss Jenny?
I think this COVID-19 has showed our gaps in our sustainability and our infrastructure. And this needs to be the great debate of 2020, is making sure that people have sustainable income in, Social Security for all, Medicare for all, that we need to identify these weak links and make sure that we have the ability to weather a crisis like this. If we had Social Security for all, we wouldn't have to worry about stimulus checks for anybody. If we had Medicare for all, we wouldn't have to worry about any medical consequences. We would be able to get people in the right places, It would be funded. We wouldn't worry. Hospitals and doctors wouldn't have to worry about getting paid. That would be a non-factor. We wouldn't have cities and counties and states trying to bail people out and bail businesses out. It's time.
Exactly right. That's so true. And Ms. Barbara, thank you for joining us, and hopefully we'll get you working so you can join us again. I put up this video because I wanted you to see Dr. B dancing. This was that was the last live show we did right before the the stay-at-home orders went into effect. And so I always think I like to watch that. But for those who are politically involved, as Tara said, please make your voice be heard. I can just tell you, as a Democratic Libertarian, I'm so
Rebel.
I am so happy I never said vote blue no matter who. And the reason is those who said vote blue no matter who, no one's going to pay attention to them because Biden knows I got their vote. It's the people who didn't say that now he has to go after. So as you get those calls, as you get those, please vote for Biden, tell them the issues that you think is important, because now he has to earn the vote to get in. So strategically, it was smart for progressives not to say vote blue no matter who, because now they have to come after us to get the vote. And so I just thought I'd throw that out there since we always have to throw in something controversial. Thank you so much for joining us, everyone. Thank you, Judge Rex. Thank you, Dr. B. Thank you, Councilperson Newton. And I do know that one of the things that's going to be invented by the time we end this social distancing is how you interrupt someone. We still haven't figured out, do you mute them? Do you? All right, Rex, maybe.
Just come in.
We didn't have that perfected when we did live shows and person
That's
shows
right.
either. I mean,
We had the little
there's a reason
bell.
why I called it
We had
chicanery
the
and
bell.
fuckery and the Thunderdome for a reason. I mean,
That's right.
that hasn't changed. We're just not next to each other. Yes, the alligator clap.
All right, guests and
No,
hosts.
that's not a Louisiana venereal disease.
Guests and hosts stay on just for a second. We're going to stop the live Zoom. So everyone wave. We're going to stop it.